in America, nearly 1 million people are living with Parkinson's disease, and that number is expected to rise. According to the Parkinson's Foundation, the number will rise to 1.2 million in the next few years. Joining us now to talk about Parkinson's disease is Dr. Matt Meehan, neurosurgeon from Swedish Medical Center. Thanks so much for coming on.
Thanks for having me.
Okay, so let's talk about Parkinson's disease. We know that right now there's currently no cure for it. Can you explain to our viewers what exactly it is and what it does to the body?
Yeah, so Parkinson's disease is a relatively common neurologic disorder that involves the loss of brain cells that make a chemical called dopamine. Dopamine is a neurotransmitter. It's used to signal between nerve cells. And as the brain loses dopamine, it leads to a variety of symptoms, things like slow movements, stiffness or rigidity, and tremor. And those are what usually lead to the diagnosis.
Most people know about actor Michael J. Fox and him living with Parkinson's disease, and he's really done a lot to raise awareness for it. He got it at an earlier age. Is that unusual?
It is uncommon. So Parkinson's disease becomes more common as we get older. About 1% of people over the age of 65 have Parkinson's. But about 3 to 10% of patients with Parkinson's are under the age of 50. So there is what we call a young onset version of the disease.
Does that affect your body differently as you age?
It affects people a little bit differently. Some of those patients will progress a little bit more slowly than the older patients that get Parkinson's. But fundamentally, the symptoms and the treatments that we use are the same.
You know, with many diseases, catching it early is key. What types of treatments are best for people?
So initially, what we try to do is replace the dopamine that's lost with medications that try to increase the levels of dopamine in the brain. Over time, that approach becomes less and less effective, and so that's where I come in. Patients over time may develop problems with those medications, and so we have a therapy called deep brain stimulation, or DBS. People have compared this to a pacemaker for the brain. We put a tiny wire about 1 millimeter thin into the brain, and it interrupts the abnormal rhythms that cause the symptoms of Parkinson's disease.
And what do you know, or how do you help a person decide the best course? Because it's different for everyone, right?
Yeah, there are about as many types of Parkinson's disease patients as there are people with Parkinson's. So we really try to individualize the therapy. It involves a careful discussion with a neurologist, often with a neurosurgeon like myself. But there is hope for these patients, and the big tragedy that I see is that the vast majority of patients that would benefit from these kinds of therapies never meet a specialist like myself that takes care of them.
Well, Dr. Meehan, thank you so much for coming on and telling us all about it.
Yeah, my pleasure. Thank you.
Okay, and remember, you can watch all of our interviews on our website, cbscolorado.com. Brian?
Right, Michelle, thank you.